A trip to the eye doctor can be intimidating for kids, but one clinic is changing that with a space designed to make young patients feel right at home. The new pediatric eye clinic at IQ is making the visit to see the ophthalmologist more fun for the smallest of patients.
Kids are smart and they can tell when a place is designed for them, when the space is specifically for kids, and it makes them more comfortable, and it makes it so that, like we were saying, it's not necessarily so much a scary doctor's visit as it is something where they're coming in just to get their eyes checked, which isn't as scary a thing for kids.
The walls are lined with hand-painted animal murals, and if you look closely, you might even spot Dr. Derick Holt's family pets.
My family, we are just animal lovers, and we have a new puppy and a pet kitty and a pet bunny, and so they ended up getting painted into the mural, which was really neat.
But beneath the colorful design is a serious mission to spot vision problems early while the brain is still developing.
The thing is, vision issues in kids are very different than vision issues in adults. And so you really have to have specialized training to identify and deal with the problems that occur in kids. One of the major issues that we are always thinking about, those of us that are pediatric specialists, is the fact that kids are developing, their brains are developing. And it is critical to identify problems early on so that we can ensure that the visual parts of the brain develop properly in kids.
From glasses to eye drops and even new tech, treatment options are expanding at IQ.
One of the things that tends to happen with kids that have misalignment of their eyes is sometimes you have problems where we talked about the importance of like visual development in the brain. But when the eyes are not aligned properly, that can really interfere with the development of vision in the brain. And so that we need to identify if that's happening, and we need to treat that if it's happening. And there are now some newer treatments that have just become available within the last year or two. We had them available here to our patients almost immediately after they became FDA approved and available.
And for parents of infants, Dr. Holt says real interaction is critical to healthy vision and development.
I tell new parents all the time when they bring in their babies from the NICU, when babies are young, the most important thing is that you talk to them, that they see faces. They need to see their mom and their dad's faces. When babies are very young and they're developing their vision, another thing that's important is for them to have toys that have bright colors and contrast. It's very important when kids get older that you read to your kids, that you sit down and play with your kids. Kids should not learn to stack blocks like this with an iPad. They need to have real toys in real space so that they can learn their depth perception.
And the earlier you catch a potential vision issue, the better.
There's always something that we can do. It depends on the details, but there are a lot of different treatments that are available. In many cases, it's simply a need for glasses, and when we get them the right glasses, that'll help the problem.
Dr. Holt says the good news is most kids respond well to treatment, especially when an issue is caught early with regular checkups.
It's actually very important that all kids go to their regular well-child checkups, because there's been a big push from the American Academy of Pediatrics and the American Academy of Ophthalmology to ensure that as part of well-child checkups, kids undergo vision screening.